Hello, and thank you for participating in the Wellness Wave brought to you by ACP Southern California Region 3 Chapter. My name is Jordan Anderson, and today I'm honored to interview Dr. Alana Iglewicz. Can you be so kind as to tell our ACP viewers a little bit about yourself and what you do?
Sure. Well, first, what an honor to be here with you, and thanks for having me. I have a couple different roles, and so I am a psychiatrist, not an internal medicine physician, and I am the advisor for wellness at the University of California, San Diego School of Medicine. In that role, I have the privilege of working with students and helping them both promote wellness as well as help them during moments of distress, and liaise with the deans to help promote wellness throughout the curriculum and the medical school student affairs. I am also an associate training director in the psychiatry residency at UC San Diego, and I oversee wellness and psychotherapy efforts in that capacity. And then I'm also a physician at the La Jolla VA, and there I'm the psychiatric medical director of our mental health primary care clinic, and I get to work with multiple trainees, including internal medicine residents in our psychiatric emergency clinic.
Wonderful. Thank you so much for sharing with us. I was wondering if you could tell us a little bit about how you chose your career choice.
Sure. So it's always a long one. And if you ask a psychiatrist why they chose their career path, they're always going to go back to childhood. And it's no different for me. So for me, the dots were always there to connect. It just took me a while to connect them. But I was raised in a somewhat unusual fashion in the sense that both sides of my family are Holocaust survivors. So I'm a descendant of Holocaust survivors. And from a very young age, I spent many weekends in the company of a community of Holocaust survivors. So from a very early age, I was exposed to horrors that people had experienced and saw such different reactions to adversity. And without having the words for it at a certain age, I became fascinated by resilience and wisdom and the effects of trauma. And so the rest is kind of history. I've always loved working with older adults, so I became a geriatric psychiatrist. And as friends and family recount, I would either do this line of work and get paid for it, or I would do it and not have it as my career, because they recount fun stories from being in preschool and having my teachers tell my parents that they would confide in me about their lives, and teachers in high school. And so it went on from there. But it's a wonderful career for me. And in medical school, it was very clear to me that I continued to love to just learn from people's stories and be able to help them see where they were at in life and empower them to live a healthier life for themselves.
That's wonderful and a really interesting story. Thanks again for sharing. I was wondering if you could give us a little bit of advice for our rising medical students and current residents as they're figuring out their path, especially in the realm of wellness, as that's kind of more of your expertise.
Absolutely, a wonderful question. And when people talk about their path to medicine, we break it down, at least in my mind, to the logistics of a path, like literally what career to choose and why. And then, of course, how to stay well while you're journeying in that path. And for the first, my best tip would be pay attention to what energizes you. No matter how sleep deprived you are or are not, the specialty that you are just excited to think about, that's weighing on your mind in a good way, that you want to talk with family and friends about those cases. You're excited to go dive a little deeper into the literature. That to me is hugely important. And that would be for the career path. In terms of though staying well on the journey to that career path, I think several things. I find that the more medical trainees at all levels can stay in touch with why they went into this field in the first place. And it may sound a little hokey, but I encourage all trainees, print out that personal statement, or do the equivalent of it these days. Put it on your desktop and access it. The days where you feel like you're maybe losing sight of why you're here, when you're having the harder times, I encourage people to look at it. It's incredible how you'll both laugh at yourself sometimes at your ideal ways, but you'll also tap back into something really important that really gives you that drive to keep going. I really encourage people to keep doing what filled your tank. Pay attention to what you did to relax, to stay grounded. Know that you're going to have to modify it. You're not going to have the same amount of time, especially if you're someone who took a gap year, or you think of going to intern year and your fourth year had a lot more leisure. I know you told me where you're at right now interviewing me, and that sounds lovely. For those who don't know, Jordan's in Hawaii right now. And so to pay attention to that, but to be fair to yourself about the fact that you're not going to have as much time. So you have to get creative about how you do that. I highly encourage people as they're journeying in medicine to remind yourself it's a team sport, and you have to look out for your team. You have to be there to support one another, especially when things don't go the way we all hope them to go with our patient care, with our personal lives. And simultaneously, I encourage people, be in touch with your own vulnerabilities. Don't let that be something you're ashamed of. Allow yourself to grieve when loss occurs. Allow yourself to work on getting mental health support if it's something that would be appropriate and helpful for you. And really, this one will probably come up with maybe some of your other questions, but all of us who go into medicine, we have a drive, and we come with deep empathy. We're not always taught how to have bounds to our empathy. And so it's really important to learn how to have a frame so that you don't give too much and end up being burned out, but rather have a healthy limits to how you share your empathy with the world. And simultaneously, we come into this field with perfectionism. I don't know too many doctors who aren't detail oriented, who don't want to do things just so. And that comes with a price. Now, all of us, we want a doctor who cares about details, right? We do not want our doctor to miss lab work. We don't want our doctor to miss an important diagnosis. We don't want our doctor to be negligent in filling out paperwork that needs to be filled out, even if that's the doctor's least favorite thing to do. But it comes with a price to have perfectionism. And so I always encourage trainees, work on being a reformed perfectionist. And what I mean by that is being able to turn the volume dial up when it's needed to be meticulous, so you don't miss lab values and diagnoses and whatnot, but be able to turn it down when it's just tripping you up in life. So in our personal lives, it's okay if the house is a little messy. It's a motto I tell myself in my household. It's okay if it's not the best meal ever put on the table, unless you love that and that's your way you fill your tank, and then you go full out with your cooking. But the key is to be able to have some flexibility in that perfectionism. And the first step is to just be aware of it early on in one's training, so one can learn techniques and use humor to cope with it as well.
I really appreciate that. I think it applies, and I'm learning a lot during this discussion. So thanks so much for sharing. I know you talked a little bit about burnout, and if you still feel like if there's other things you want to add, is there anything else that you've learned about wellness based off research that you've done in this area, kind of beyond what you were just talking with us about?
Oh, thanks so much for asking. Yeah, I mean, burnout's such both a hot topic and a topic that I find people are getting burned out on burnout because we're talking so much about it. And if you only talk about that, that's all people have on their radar. I'm convinced we've gotten a little bit wrong because we've been so focused on burnout of physicians. First of all, we've missed the fact that burnout applies to many more people than physicians, our nurses in particular. And if we're going to have a pandemic of following COVID, it's going to be one where we're going to have limitations in who's providing healthcare, and it's going to first come from nurses, not doctors. But with burnout, I find people, both in my research and in my work with trainees, I find that people use this term nowadays either in a rote way or in a flippant way. And I think the more refined we can get by different conceptualizations of burnout, the more areas we'll have for intervention and mitigation. And what I mean by that is, there's a classic definition that everyone can look up, Maslow's definition of burnout, and a really appropriate one, and nothing to be trivialized about that. But it only gets you so far. I find that because mental illness, although we've done a lot to destigmatize it, is still stigmatized. There are a lot of people who are experiencing major depression, and they're not comfortable saying that, but they're comfortable saying I'm burned out. But if we don't call things by what they are, we don't have the right interventions in place. I also find that burnout can be conceptualized for some as moral injury. There's a whole, some really interesting YouTube videos on this. I'm not convinced that fully captures it, but I think it's important to think about when the system is a mismatch for someone's goals and desires for what they want out of their career and how you make sense of that. I think the other important way of conceptualizing burnout is to think about burnout as a loss of meaning, loss of connection as to why people are even doing what they're doing. And so interventions could be tailored around that. And then I'm biased. I study grief as well, removed from physician wellness. And for me, I'm convinced that sometimes burnout can be conceptualized as unresolved grief. We never gave our chance to grieve our patients' losses, their deaths, their tragic outcomes at times, grieve the fact that our system isn't what we hoped it to be when we entered this field. And I think the more we can do that, the more we can end up grounded and able to think in a very critical and savvy way about what interventions are needed at a system level.
So we have a couple of wellness questions,
Right.
and we'll go with the first one first. So how would you generate a personalized toolkit to manage stress, specifically with regards to medical students and resident trainees?
Oh, I love this question. I mean, the question is how much time do we have? Because this one, we could spend 2 hours talking about this. But my take homes with it would be to first start with the context, which is that everyone needs this, whether they do it consciously or unconsciously. Everyone needs to do this because the reality is that medical school is stressful, residency is stressful, fellowship if you do that is stressful, life as a physician is stressful. Living as a human being is stressful. This pandemic has been stressful, right? So we just need to start with the fact that stress is part of life and it shouldn't be something we always shy away from. It doesn't mean we should just accept it and roll over, right? But it also is just something I think you first have to start with. Everyone needs a toolkit, if you will. People go about it in very different ways with how intentional it is, but I think when you're in medicine, you need to be intentional about it. When I think about a personalized toolkit, first you have to break it down to components, right? And so to me, the components that come to my mind would be components such as physical component, psychological component. One, a lot of people don't think about is connection and the role of connection. And I think that's a key one. And then there's also, spiritual / meaning component. And then the final one that I think is really important is what I conceptualize as a relaxation reflex, sort of a calming technique or techniques for this matter, essentially a way to calm the nervous system. And I'm convinced that everyone's personalized toolkit should involve these components. Most people probably are very overt about some of these components, but probably not about all. So, so in terms of connection, we are profoundly social beings as human beings. And this pandemic has been a nightmare for people, especially medical students who are brand new to medical school, who don't know people yet, who are learning virtually and don't have these opportunities to create a social network. And I think we have to be more intentional than ever in this regard. And so that would be number one, is for everyone to think about where they're connected and where they're not, a path to forge those connections in creative ways when it's needed, such as the past 2 years have been. In terms of physical, this is when everyone wants sort of the checklist of, what do I do to succeed? And the reality is one has to just do some soul searching, ask themselves, what have they historically done that's been great for them as a physical outlet? If they haven't had that, time to find something and do what you love. We all know from those of us who provide patient care, you can't instruct someone to do a certain exercise. If they don't enjoy it, it's just not going to work out. So I encourage people to find something they enjoy. In terms of psychological, we talked about this notion of perfectionism and being a reformed perfectionist. I think that is really key to the psychological component. And there's so many others. Just to acknowledge imposter syndrome for a moment with the psychological component. We, especially as empathic and very high achieving individuals who go into medicine, we typically compare our low points with other people's highlights of their life. And when we do that, we always are going to fall short. And so we have to find ways to tap into the fact that we're here for a reason. And sometimes we have to remind ourselves of that. Sometimes you have to remind your peers of that. Sometimes you need a faculty to remind you of that. But you seek out wherever that reminder is going to come from, that everyone came to medicine. They were selected for a reason. They have what it takes. They may just need a little bit of support to get there. And the more we remind ourselves of that, the more we can find peace with imposter syndrome. I really encourage people in medicine, especially females in medicine, know that imposter syndrome is universal. It is something that doesn't go away in one's career. It's just your relationship with it that can change. And so I encourage people to just know that early on, so they're not beating themselves up for even having imposter syndrome, which is not a psychological healthy way to proceed. And then, spiritual meaning. I mentioned, I always want people to tap back into why they went into this career, and that will serve them well. You don't need me to give a lecture on spirituality. People will find that in their own unique and beautiful ways, or not find that to be applicable to them, and that's okay too. But meaning always is. And then the final one that I mentioned, of course, was the relaxation reflex, as I call it to be. And there's so many ways to go in to get at it. But a lot of people don't realize that all humans have the capacity to calm their nervous system. It's just a matter of learning techniques. One can go about it through meditation, if that's something you're into, mindfulness techniques, although that can be more of a philosophy on life as well. For some people, massage or acupuncture. For some people, yoga and especially some breathing techniques. And then for some people, they get in a meditative state when they run, when they swim, when they do martial arts. So really, it's just a matter of what someone's unique way of tapping into this is. But I encourage people in medicine to just stop and realize they're going to need to do it, though. So it's just a question of trying out a buffet of options and seeing which one appeals to you. And even if some of these don't come naturally at first, that may mean you're the group of people who actually really needs it even more than other people. You just need to work harder at it, and it will pay off when you do that.
So now we'll move on to the wellness quote, if that's okay. And so we're having a wellness quote for specific interviews. So we appreciate you participating in this. So do you have a favorite wellness quote that you would like to share with us? Just something short that kind of either helps you or you thought about in the realm of wellness.
Oh, there's really good ones out there. Is it totally unfair if I share two?
Of course not. That would be wonderful.
Okay. So one of my favorites is, one cannot serve from an empty vessel. So that would be my number one. But my number two is one that I've come up with in my work with medical students over the years. And that's, don't let adversity define you. Rather, let adversity refine you.
Oh, very interesting. I really like that quote. Well, thank you so much for spending today with me and for sharing your knowledge with us. We really appreciate this. And I know that many medical students and trainees will be watching this video and taking a lot of glimmers of ideas and thoughts about wellness from this. And thank you again for your time.
Well, it's such an honor to be here with you. And thanks for such a fun interview, Jordan.